Welcome to our Wednesday news hours, where we hear from social entrepreneurs and their teams from around the world about timely topics and solutions. My name is Nani Zulminarni from Indonesia. I'm Ashoka Southeast Asia Diamond Leaders. We are thrilled to have many of you joining today from Ashoka's global community. And also a big welcome to those joining from ALZI Indonesia and the Asia Pacific Alzheimer's Disease International Community. In fact, September is the month of Alzheimer's. So today for the next 30 minutes, we'll be hearing from Kusuma Dewi Suharya, or in Indonesia famous as DY, Ashoka Fellow from Indonesia, with the theme Memory Loss and the Journey of Career. So now let's warm welcome our today's guest, DY, Ashoka Fellow since 2017, founders Alzheimer's Indonesia, and Regional Director of Asia Pacific Alzheimer's Disease International. Hello, DY, how are you?
I'm good, Nani. How are you? Thank you for inviting me.
Yeah, wonderful to have you here and can't wait to hear your remarkable story. So there are 50 million people with dementia around the world, nearly half of which live in the Asia Pacific regions, in our regions. So DY experienced firsthand the lack of social support for patients with dementia and their families when her mother was diagnosed. So DY founded ALZI to pioneer a cross-generation movement to improve the quality of life of people with dementia and their caregivers. So DY, tell us what brings you to this journey, where not so many people really aware about it, and sometimes people think it's far away from them, and yet to seriously work on this issue.
Thank you, Nani. So what brought me to this journey was my own experience of taking care of my mom. My quality of life is affected. A person with dementia, one person, the entire family is affected. So I've discovered that there are 3 root causes, which is lack of knowledge and awareness, lack of diagnosis, care and support, and lack of information. As somebody who had gone through the journey of caring, having somebody with dementia, a neurodegenerative disease affecting the brain, memory, executive decision, emotion, and all that, it's really affecting your own mental health and well-being. So that's the root causes. So the bottom line was basically my quality of life is affected, and the person with dementia is also, needed guidance in this journey and needed to be supported by the family and all the surroundings. So that hopefully that answers your question, Nani.
Thank you. It's sometimes people always on things that dementia is always talk about elderly people, right? So what actually is different working on dementia issues and working on longevity, for example? How do you see that?
That's a very good question. So basically, dementia, there's risk factors. There's 12 risk factors affecting, dementia, lack of physical activity, smoking and all these things. There's all these literature I can share, and you can see in the website, alzint.org, Alzheimer's Disease International, or Alzheimer's Indonesia, alzi.or.id. But basically, there's higher risks when you reach 60 above of getting dementia, but there's also young onset dementia, early onset dementia, and the entry point of the early onset or young onset dementia varies. It can be brain damage, it can be familial Alzheimer that was shown in Still Alice, the movie. So it's basically an invisible disability. And, when you, eventually we grow old and we still want to be independent. We still want to have meaningful engagement and meaningful life and all that. So this is why it's also linked up with longevity issue. You want to make sure that your brain is healthy, and you want to do everything you can to prevent and to reduce the risk. And it starts now. It doesn't start later when you reach 60.
So So this means that the dementia can happen to also young people, right?
Correct.
I mean,
Yes.
it's not, yeah. So how then you bring awareness of this dementia while people usually, I think, particularly in Indonesia, people do not really, aware about this. Sometimes do not understand that this is dementia, and people thought is, oh, sometimes young people feel, oh, it's far away from me. How do you bring that awareness into the society, the community?
It's actually based on the life cycle approach. So what's good for your heart is good for your brain. So there's basically for young people, you basically want to always have, I think millennials are really into having meaningful life. For the young generations, it seems to be far away of getting dementia, but it can happen to anyone, and there are some cases, although minimum cases affecting young onset dementia or young people. So how do I create that kind of interest for young people? I actually, through the movement of Jangan Maklum dengan Pikun, do not underestimate memory loss. It's actually something that is connected to the young people, like it's something that is relevant to them, and it's also I think we also created a different kind of tagline that's linked up to them. In Indonesia there's this term called galau, stop galau, dampaknya terasa di hari tua, which means like you have to stop, you have to make a deadline whenever you feel kind of miserable or not sure and all that, because it would affect later on, 5 years later or 10 years later. So if you're not feeling good or you're emotionally affected, you just have to make sure that you discipline yourself and say, no, I want to just spend a few hours of this really not uncomfortable, it's an uncomfortable feeling, because I don't want to entertain my thoughts, because I want to have a healthy brain, because this is something that's temporary, anicca, nothing lasts forever. So for young people, it's something that's, if they're really into doing something good, they can contribute their talents, their expertise, and that's one of the goals of Alzheimer's Indonesia, becoming a platform, not only improving quality life of people with dementia and family caregivers, but also a platform for intergeneration, for young people to contribute their expertise. There have been a lot of young people contributing their talent in music, songs, fundraising through the music, creating some paintings, creating animation, design, contributing as a digital assistant, because young people are so savvy in using their computer and everything. So elderly need to be assisted through gadget literacy, those kind of activities. So anything that appeal for young people in contributing their talent and bringing meaning to their life and bringing meaning to the elderly as well. So that's a bottom line on this. So it's something that's really close to their talent, really close to what they're good at, and they can contribute through this platform and this NGO.
That's great. I remember one, when we celebrate this, the elderly, Indonesian elderly people, right? And you give talents for young people to take pictures of their family, where they with the young, with their grandparents or whoever, and then you use that to post it on the social media. So I noticed that your focus very much cross generations movement building in order to respond to this. Is there any particular reasons why you really try to bring this across generation or multi-generation in this movement building you do?
Yeah, actually, I think, this is just a personal thought from the past. I think parents are God's representatives on earth. I think, you know, they are, I myself, I had the experience of not really, I wasn't really a, you know, not really a good daughter of leaving them for 15 years. I was overseas 10 years in the States and 5 years in Australia. But I realized once I wanted to get closer to them, once I want to do something good for them, the universe is helping, paving the way, making things easy. And in Indonesia, I think there's a term that if you know, kind of spend quality time with your parents, all things will be convenient. It's all going to be given to you by the universe. So I think it's just a matter of my own experience, having how I have the natural high whenever I make somebody, elderly people are happy. They only wanted that feeling of being surrounded by their grandchildren or daughters and son and all that. It's really simple things to make them happy. And by what you said, when we had the opportunity on Elderly Day, National Elderly Day in Indonesia, we challenged young people to capture that moments, beautiful moments with their parents, through photos and all these videos. Capture that precious moments that you have with your parents, elderly, uncle, you know, aunties, because it's something that really, you know, for me, it's something really special, and it's something that I want to share to other young generations as well.
Yeah, yes, that's great. I think you know, really growing the empathy, yeah, empathy to the older people, and then how these young people to be part of this process of building this movement is really great. I experienced this. I think it's really inspiring. So
Nani, Nani, you mentioned the really key word. That's it, empathy. Building empathy is actually one of the goal of you know, how young people with, you know, having empathy, engagement, empowerment, you know, like knowing that they can contribute simple things, their skills and talent, and really make someone happy, you know, their parents happy, the elderly happy, because there's a generation gap, right? So that's why.
Yeah, particularly at this time, yeah, when young generations very much, you know, on this technology, virtual space. So, and sometimes people with dementia asking, you know, a question in repetition, and they're not patient enough to respond to that, and they don't understand that this is dementia. So let me check on the question. I have many questions, but let's check on the from Dina Lumbantobing. What makes dementia worse that should be avoided by someone who has symptoms of dementia?
What makes dementia worse? So again, the definition of dementia is a neurodegenerative disease affecting the brain, affecting memory, executive decision, emotion, and other brain function. So what makes it worse actually is because your daily activities is affected. Somebody who have been affected by dementia, that's why there's all these elderly missing cases in Indonesia or other countries. That's a very, very painful situation for families who have their elderly, their parents lost in the middle of nowhere, not knowing where to go. So it's, you know, if you ask, that should be avoided by someone who has the symptoms. If somebody has these symptoms, it's the better you have diagnosis, the better quality life, the better preparation. So knowledge is definitely power. And that's something I experienced myself. My mom showed symptoms 20 years before she was diagnosed. If only we knew that that's the symptoms of dementia, it really would help us understand and would avoid unnecessary arguments in the family. So that's something that you know, basically, I hope I answer your question.
I think I think in relation with that, this is another question from Amelia Hapsari, whether some people are more susceptible for dementia, and can we try to avoid it?
Yeah, we can try to avoid it. Literature has stated that physical activity, 30 minutes a day, 150 minutes a week, could reduce risks of dementia and other non-communicable disease. Having this, you know, joining this session, connecting with people, getting engaged, stimulating your brain are ways to reduce risk of dementia. There's all these risk factors, including depression, you know, pollution and all these things. That's actually the risk factors that could open up the risk of getting dementia. So yes, we can do everything we can to make sure that we don't get dementia in our lifetime. And if we have families that's diagnosed or show symptoms, that's why Alzheimer's Indonesia was established, to help navigate families on what to do, how they can be supported through the support groups, linking them up with the right doctors who can provide diagnosis and prepare pharmacology and non-pharmacology treatment for the person with dementia, and providing support for the entire family.
Yeah, and I know you, ALZI Indonesia, produced this video, right, for like exercising to really protect you from dementia at the early age, and this is very famous. It's become viral, no? Even in my community, they watch that video with their community. So
yes,
yeah, that is great. Yeah, Amelia, you have to see that video. Chris from Kristano, when you look at the ordinary Indonesian citizens who have become active on dementia issues, either in their own family or in the public, do these early adopters share any personality traits or characteristics? What makes them take actions? Because
that is
right?
That is a brilliant question, Chris. Thank you for asking. You know what? ALZI has been around for the past 8 years, and we actually identified the champions. We started only with, like, I think 5 chapters, and now it has grown to 21 chapters, 16 in Indonesia and 5 overseas. And the overseas are the diaspora, Indonesian who wanted to do more. So the characteristics are basically either they have families that have dementia, diagnosed with dementia, they had a chance to take care of their family, or they didn't get a chance to take care of their family. They want to do more, and they are multidisciplined, and they actually have talent. They want they're actively engaged in their own communities. So these are the characteristics. We're very lucky that we have chapter leaders in those 21 cities. I think overseas it's in United States, San Francisco, and UK there's in Belfast, Groningen in Netherlands, Doha in Qatar, and also Geneva, Switzerland. These are Indonesians that actually step up and say, we want to do more about this cause. And some of them don't have families with dementia, but they got attracted by the branding, the wording, the tagline, do not underestimate memory loss. They have families. Some of them have families, some of them don't. But it's something that people can relate. Either they don't want to get dementia when they grow old, or they have families that have shown symptoms. These are the characteristics, and mostly they actually are active in their own community. Like somebody is a church leader, another person is really a very avid, mountain biker, marathon runner. So there's all these characteristics from them that they're really good at, and they try to channel their talent and their expertise through supporting this cause.
Okay, wow. Yeah, so I think it's very important to really have this support system, right? And this
Yes.
Amelia has questions, how do you support the support group, like the family that live with people with dementia, and then how can carriers also care for themselves, and is there any way to really, to really help them to be still be independent and help themselves in this kind of situations?
Yeah, thank you, Amelia, for the question. You will be surprised that there's actually young caregivers, and these are the people that got affected financially as well. They had to resign from their office because their mom or their dad called them 10 times, 50 times a day, so they cannot concentrate. So for caregivers, what we do is basically the young caregivers or the baby boomers or the millennials, we actually have counseling sessions. Before the pandemic, we're supported by an organization that's actually offering us a space. And there's physiotherapists and occupational therapists and psychologists who help us because these caregivers mostly experience burnout, experience exhaustion, mental exhaustion, and they have to have a me time. So when we conduct these sessions, the caregivers receive these psychological kind of advice and tricks and tips and tricks on how to navigate and taking care of themselves and taking care of people with dementia. For the person with dementia in the other corner, this is a big space. They're supported by a physiotherapist and occupational therapist. They get engaged, interacted in certain games and all that. And during pandemic, what we do is we organize webinars, we organize counseling sessions supported by the care navigators and also psychologists, helping families on understanding on what to do when they got puzzled, when they're puzzled in dealing with their person with dementia. So the answer is yes. This is why we exist, because I myself experience the pain, the exhaustion, the need of me time, and it's something that having a support group in a WhatsApp group, supporting each other. And Alzheimer's Indonesia actually provided online counseling consultation, one-on-one with a doctor, with care navigators. We also facilitate counseling sessions with 20 or 30 people, caregivers, and virtually breakout rooms and everything. So we also produce books, merchandises, link them up with the doctors, link them up with any products and any support they need. And that's actually the power of community-based support groups, being there and knowing that you're not alone, which is the hashtag for World Alzheimer's Month this year. You're not alone.
Yeah, it sounds like, yeah, we need like really one full ecosystem to support the people who has dementia and also the family, the caregiver, right? So
yes.
why after this long journey, when you started, if you compare from when you start this work and with the situations now, how do you see the change on people, dealing with this situation? And is there any change in terms of also policy, for example, in Indonesia related with the dementia issues? Is there any support system, in our whole system, our health system, to really, helping family with this dementia and helping people with dementia as well?
Yes, that's a good question. Ecosystem-wise, we have been working closely with Ministry of Health from the very beginning. Out of our movement created noise, and the Ministry of Health in 2016 launched Dementia National Plan and literally said to me, you created too much noise for these past 3 years, so there's nowhere to hide from me other than launching a dementia plan. And there's 7 action areas covering support for caregivers, awareness raising, dementia as a public health priority, research, innovations, technology, and all that. So the changes, when you mention the keyword changes, their behavior changes happen because of a campaign. We do it consistently all the time. There are 300% increase of people requesting for diagnosis in 3 hospitals in 3 provinces in Indonesia. That's between 2014 to 2015. There's behavior changes that we're aiming is respect to the elderly increase. There's young people creating TikTok, dancing with their elderly, their parents, promoting healthy lifestyle. There's all these videos. We produce these videos, brain gym exercise. People are into the Melawan Pikun Challenge, do not underestimate memory loss challenge. And we aim to be, the go-to source of everything related to dementia for people with dementia and family caregivers, and also for young people to contribute their talent. So for policy-wise, there's the Dementia National Plan launched in 2016. So the government listened to us. There's Elderly National Plan 2020. And just fresh from the oven today, we received this Strategic National for the Elderly decree signed by the president. So it's just a matter of we have to keep on banging the door. We have to keep on voicing, because as an advocate, from the keyword advocare, we're speaking on someone's behalf, someone that we care the most, and we must create the elderly-friendly, dementia-friendly environment, whether it's a provincial, regional, district, national level, everywhere.
That's great achievement, right? A change on this micro level. But there's another question, I think. So one more question of this coming. Caregiving is a challenge, yeah, right? That's one of the biggest challenges, whether you are caring for someone with dementia or with other health ailments. And are you, in your journey, are you finding opportunities to build bridges to other movements that also work with caregivers, maybe on HIV/AIDS or others?
Yeah, so of course, caregivers is being a caregiver is a challenge. So being a caregiver for a person with dementia, unfortunately, one of my family members diagnosed with cancer recently. So I know I am doing my best to help my nephews and nieces as a young caregiver for their parents, for their dad, in going through this journey. So there are all these common thing, which is as a caregiver, you also need to be healthy, and you also need to know your body is the best alarm, and you have to create roster. So basic structure, if somebody is sick, the family have to organize a family meeting, understanding the structure, understanding the scheduling, understanding the menu, creating all these planning. So we also been closely working with, we're part of the NCD Alliance, Non-Communicable Disease Alliance, with the Association of Heart Disease, Diabetes, because we share similar risk factors. But one thing for sure, for this World Alzheimer's Month, no dementia, no Alzheimer, the timely diagnosis, the global theme, we are shining a light on the warning signs of dementia and the importance of timely diagnosis. Once you get diagnosis, what's next? There's post-diagnostic support. So these are something that's really common that could be applied in other causes as well. And it's something that we, as a caregiver myself, I realized when I had no clue at all about something, it's so confusing, it's so dark, and we don't know where to go. And this is why we exist. We want to shine a light on knowing, empowering, equipping caregivers and people with dementia and across generations on these 10 signs, and know that you can contribute your part, no matter how small it is. It's still going to improve. It's still going to contribute to improving quality life.
Quality of life. Just my last question. So before we close this,
yes.
How you would like to see for the next 10 years from now on your journey to this dementia, particularly?
It's a very good question. So the vision is, of course, improving quality of life for people with dementia and family caregivers and intergeneration. The ambition is 1 million families have access to 100,000 care navigators in 10 to 20 provinces through technology, through application, platform, And in the system of diagnosis, care, and treatment ecosystem for people with dementia in Indonesia, we want to introduce the role of coordinators or care navigators and enhancing relationship between all diagnostics, treatment, and care to ensure adequate and coordinated services. So the vision is basically having because of pandemic, we have this limitation, but we can create a center of excellence in healthy aging, center of excellence in longevity, center of excellence, all related to all line related to healthy aging, and dementia is included. That means we identify champion, cause, commitment, collaboration, and contribution. So the vision is, becoming a change maker. You can start small and you can contribute your part no matter what in this journey of caring.
Wow, this is very powerful conversation, and I think I learned so much about this dementia because it's close to my heart as personally as well. I faced this being a caregiver at my mother-in-law before. Thank you, DY. So, but before we end, thank you also for all participants here in this Welcome Change sessions. Before we end this conversation, just few announcements. So look out for a follow-up email with a link to today's recording and highlights to browse and share. And we hope you will join next time. It's another interesting conversation talking about patients' huge waste problem and what we can do about it. So Welcome Change is a weekly series about the future we want to live in and the role we can all play. You can sign up at the link in the chat. And first, thank you, DY, for your inspiring and powerful stories, and hope everyone learn and understand about dementia and how can we be part of this movement. Thank you, everyone. Have a good day and see you soon.